Because it is a one-dose effective vaccine, these doses will be focused on those who are in the hard-to-reach areas. That is to say, the riverine areas, desert communities, security compromised areas, and also the elderly. This is because these are the people who may find it difficult to leave their homes to the health facility for the second dose after taking a first one. So we're going to be optimizing these doses that we've received for these people that are usually vulnerable and live in the most hard-to-reach areas. As a result of the leadership provided by the Presidential Steering Committee, the Federal Ministry of Health, MPH-CDA, in collaboration with our partners, we have mapped out the best strategies in targeting different segments of our population because of the vulnerability in the age and geographic constraints. We are collaborating with the Ministry of Finance, Budget and National Planning through Degree 3 project to map out using geographic information systems to understand where this population exists so that we can also devise ways of reaching them. Let me emphasize that the Nigerian government is committed to safe, equitable and effective COVID-19 vaccination of all eligible persons in the country. The availability of different vaccine brands does not in any way mean that some categories of people are being selected for high quality vaccines while others are targeted for low quality vaccines. All COVID-19 vaccines approved by the World Health Organization and NAFDAC are safe and can deliver adequate protection against COVID-19 against COVID-19. You are aware from all of the data that is coming from different countries that COVID-19 vaccines protect against severe forms of the disease, hospitalization, and deaths. The different vaccines have exactly the same ability to protect against the disease. The different proportions or percentages in terms of efficacy depends on the type of clinical trials and the populations that have been assessed. However, these vaccines have been proven to protect against COVID-19. So please take the opportunity of going to the designated healthcare centers to get your vaccines. We will continue to count on you, the media, for dissemination of true and accurate information to keep Nigerians informed and educated about COVID-19 vaccination. We also hope that those who are misinforming people will begin to understand the need for Nigeria and the rest of the world to overcome the COVID-19 pandemic and recover from the adversities it has imposed on our economies and social lives.
It is worth it to note that Nigeria will receive in August a total of 1,173,132 doses of Johnson & Johnson vaccine, followed every month by deliveries until we reach the total volume of 29.8 million doses. The target is to deliver almost 50 million vaccine before the end of December 2021. By January 2022, the number of vaccine being released will be in excess of 25 million per month. In collaboration with the African Medical Supply Platform, AMSP, Africa CDC, of course, our local partners and the Federal Republic of Nigeria, represented here by the National Primary Healthcare Development Agency, UNICEF, is providing logistical and delivery services to member states. Shipment for a total of 6.4 million doses began in August 2021 and will arrive in several member countries. This vaccine acquisition is a unique milestone for African continent, and it is the first time Africa has undertaken a procurement of this magnitude involving all member states. It also marks It is also marks the first time that the African Union member states have collectively purchased vaccines to safeguard the health of African population. 400 million vaccines are sufficient to immunize a third of the African people and bring Africa halfway toward the continental goal of vaccinating at least 60% of the population. International donors have committed to deliver the remaining half of the doses required through the COVAX initiative. It is significant that these vaccine doses are being produced on the African continent at the Aspen Pharma Care Facility in South Africa. This is part of the concerted effort by African countries to rally the world to support the TRIPS waiver for technology transfer and active pharmaceutical ingredient to develop our own manufacturing capacities and capabilities. Quoting Professor Benedict Okeorama, President and Chairman of the Board of Directors of the African Export-Import Bank, the very low access to vaccine has exposed Africa to a devastating third and fourth wave of COVID-19. Death rates are rising and economies are being increasingly vulnerable. We are encouraged by the successful commencement of this vaccine rollout, which will help contain the spread of the virus and protect lives and livelihoods. Afreximbank is pleased to have contributed to the historic procurement of vaccine by AVAT.
First of all, I want to congratulate the Africa CDC, President Ramaphosa, and the AU and ECA for putting together a consortium with the speed that they have and effectively as they have in this period of time. And we see today the first delivery of AVAT vaccine, the 177,000 doses of Johnson & Johnson. It really was an incredible effort that you've put in over this time. But may I also use this opportunity to congratulate the ED of MPCDHA and the Nigerian government for your forethought and preparedness to procure 29.8 million doses of Johnson & Johnson through the AFAT facility. Without that anticipation and forethought and good planning, we wouldn't see this, these doses, 177 Johnson & Johnson doses, come in today. And as my colleague has said, that they will come in on a regular basis over the next few months. But finally, and importantly through you, the media, is to say to all people in Nigeria. Last week we received the Moderna vaccines, today the Johnson & Johnson vaccines. Next week we will receive more AstraZeneca vaccines. They are coming in on a regular basis. This is the time to step up and get vaccinated, to take your responsibility, whether you're an individual, whether you're a religious leader, a traditional leader, or a governor, is to encourage all your people to take the vaccines as quickly and as timely as is possible in an orderly fashion. The vaccines are coming in and we must do our part.